Kate Flynn, President of the Healthcare Improvement Foundation, and I'd like to introduce the 2012 winners of the annual Delaware Valley Patient Safety and Quality Award. For more than 10 years, we have recognized local hospitals for demonstrating innovative and effective practices in assuring the highest levels of quality and safety. This high level of interest in the award underscores our shared commitment to continuous improvement of the care delivered to patients in our region. Please join me in congratulating the 3 organizations that are this year's award winners. Thank you.
At Chester County Hospital's emergency department, a significant subset of patients presented with low-risk cardiac symptoms and were admitted to observation beds. To better serve these patients, a team of physicians and other staff from the ED and cardiovascular services developed and implemented an accelerated low-risk cardiac symptom protocol.
We wanted a program that could help with our throughput in the emergency department. We wanted a program that also provided an evidence-based platform to provide care. And we also wanted to make sure that the cardiology services and the emergency department not only had a very collaborative practice, but a practice that really met the best needs of the patient.
Using a clinically proven cardiac risk assessment tool, patients are evaluated and put either on track for discharge or further examination. A nurse navigator circles back with patients after discharge to coordinate cardiologist visits and make sure that patients access the follow-up care they need. Using this new protocol, the hospital has cared for 200 patients over the past 6 months.
It's been more than successful. About 84% of our patients, instead of being admitted, have been discharged. And that gives us the availability of many more beds in-house, and so that the right patient has the right bed at the right time.
In recent years, the emergency department at Thomas Jefferson University Hospital has seen a dramatic increase in patients. Jefferson's intake program was designed to address the waiting room delays and patient flow issues that resulted from these high patient volumes.
At Thomas Jefferson University Hospital Emergency Department here in Center City, we treat over 60,000 people every year. We treat people of all backgrounds, and we treat a range of illness, ranging from minor injuries all the way through to life-threatening illnesses.
The Jefferson Emergency Department put together a core team of doctors, nurses, technicians, staff from radiology, and staff from environmental services to plan the range of changes needed to improve patient flow in the ED.
As an emergency physician, when I'm working a shift, what I worry about so much is that there's going to be a patient in the waiting room who's really sick, who's getting sicker before we have a chance to get to them. With this program, we can get to them more quickly, find out what's going on, and get that treatment started. And that makes me feel great.
I am honored and thankful both personally and professionally for this award. We were able, with this project and the teamwork, decrease our walkout rate by 50%. Our time on diversion is nearly non-existent. Our time to provider is also cut in half. The team had an opportunity to see the rewards of their work. Our leadership has the honor of participating in this day's events. But really, the end result of this work, of our leadership, is the patients. And we have been able to create a safe and efficient system to make our patient experience a better one. Thank you.
Hi, my name is Craig Umshad. I'm one of the hospitalists at the University of Pennsylvania, and I direct the Center for Evidence-Based Practice for the University of Pennsylvania Health System. And we had the good fortune of being involved in a project to help reduce catheter-associated urinary tract infections.
Catheter-associated urinary tract infections are the most common type of healthcare-associated infection. Up to 70% of these infections may be preventable with recommended infection control measures, translating into 380,000 preventable infections and 9,000 preventable deaths annually.